Hi guys, this is Rara Coco, and let's go ahead and talk about Sava, ticker symbol Sava, SAVA, Cassava Science. Boy, oh boy, I am so excited about this ticker symbol. There's just so much future about Cassava Science, and they have two products that are doing really, really well. First one is the Simufilam. That is the medication. It's a tablet, it's an oral medication that is the future of Alzheimer's and dementia. Because what it's supposed to do, it's supposed to reduce the dementia or Alzheimer's disease. That's the Simufilam. Drastically, improve thinking, improve memory. And at this time, they are on phase 1, phase 2, phase 3 is done. And they are on the phase 3 part A right now. It started in October 6. The other one is the Sava Diagnostic tool, which is a tool that you can get a blood test, a prick on the blood, right? And it will detect if you're going to have dementia or Alzheimer's disease. This is on the testing process, and both of them, Sava owns this procedures, owns this patent, and they're the only one who can pretty much study this and distribute it, and they are on phase 3. Okay, so this ticker symbol Sava Science, or Sava SAVA, if you looked at it right here, it went to $42.18, right? Because of the fake accusation that they said that Sava Science manipulated the data with regards to the clinical findings. It was proven wrong, proven dead wrong, right? We know that now. That was just published a few days ago. But anyway, guys, don't get disappointed, because right now, if you look at $89.49, this is great. I like what the price action is. It's because from 42 ripped, consolidate, right? It needs to consolidate and then ripped, and now it's consolidating again. So guess what's going to happen again? It will be ripped, going up. So be ready. It's going to go up. All right, so that's for that. Now let's talk about their product. Okay, I will do a PowerPoint presentation with you that I prepared. I'm going to start with that. All right, here it is. Simufilam. Simufilam is a proprietary small molecule. It's an oral drug that restores the normal shape and functions of altered filament A, FLNA, a scaffolding protein in the brain. So filament A, also the abbreviation is FLNA. This is a protein that is in your brain. Altered FLNA in the brain disrupts the normal function of neurons, leading to Alzheimer's pathology, neurodegeneration, and neurofilamation. The underlying science for Simufilam is published in peer-reviewed journals, including Journal of Neuroscience, Neuromicrobiology Aging, Journal of Biological Chemistry, Neuroimmunology, Neuroinflammation, Journal of Prevention of Alzheimer's Disease. Simufilam is substantially supported by peer-reviewed research grant awards from the National Institute of NIH. So this protein, just FYI, it's either if it's elevated or lower level, or it's expanding, or it's not the right size. If it's abnormal, if it's becoming abnormal, or if it's being affected, what happens is it blocks signals and informations towards our neuron on communication. And what it does is it is affecting our memory. All of a sudden, we are slowly forgetting our names. We are slowly forgetting how to close the door, how to sing ABC, how to speak English, how to speak your natural languages. It's affecting all of that. It's affecting that memory. But guess what? This medication was already used on phase 1, phase 2, and now it's on phase 3. And so far is the best medication out there for dementia and Alzheimer's disease. Guys, ladies and gentlemen, this is a game changer. My name is Rara Coco. I'm not a financial advisor, okay? I'm just a stupid guy out there. But anyway, I've studied this. But anyway, my history is I'm also a registered nurse, and I still practice as a registered nurse. But I love stocks. I buy stocks left and right. Anyway, with regards to this medication, Simufilam and SavaDX, these are the two products that Sava has, right? So SavaDX is the other product that they have. We're both developed in-house because Sava Science owns worldwide development and commercial rights to its research program, Alzheimer's disease, and related technologies without royalty obligation to any party. So I want to let you know that National Institute of Health gave Sava Science, donated, or whatever you call that. NIH gave them money or awarded them money to continue studies with regards to this medication, because somehow it's very promising. It's showing a lot of effectiveness. It's showing a lot of future, and it's a game changer. Remember that medication. The name of the medication is Simufilam. Simufilam. The other product that they have is the SavaDX, right? The SavaDX is a blood test. They prick your finger, do a blood test, or whatever blood test that they're going to check, and it detects if you have Alzheimer's disease or dementia, or if you're going to have to. So last October 6, 2021, Sava Science initiated the phase 3 efficacy trial of Simufilam for the treatment of patients with Alzheimer's disease. Okay, the first phase 3, which is this one, already started study called Rethink ALC. So the phase 3 study is called Rethink ALC, is designed to evaluate the safety and efficacy of oral Simufilam 100 milligram enhancing cognition and slowing cognition and functional decline over 52 weeks. Secondary objectives include the assessment of Simufilam effect of neuropsychiatric symptoms and caregiver burden. The randomized, double-blind, placebo-controlled study plans to enroll approximately 750 patients with mild, moderate Alzheimer's disease in the US and Canada and eventually overseas. This is big. Now you know why this stock from January went to $2 to 100 something. It's a game changer. About the second phase 3 study, they're gonna call it Refocus ALC. The second phase 3 study called Refocus ALC, which is expected to begin by the year end. It will begin by the year end, is designed to evaluate the safety and efficacy of oral Simufilam 100 milligram and 50 milligram over 78 weeks. This is an oral medication, and these are the dosage for 100 milligram and 50 milligram over 78 weeks. This randomized double-blind, placebo-controlled study plans to enroll approximately 1,000 patients. They can enroll 1,000 patients with mild, moderate Alzheimer's disease in the US and Canada and eventually overseas. This is big, right? Big. They are now on phase 3. About Simufilam. Simufilam is a proprietary small molecule oral drug Okay, let's do this again. About Simufilam. Simufilam is approximately small molecule oral drug that restores the normal shape and function of altered filament A, FLNA protein in the brain. This is how that one works. Altered FLNA in the brain disrupts the normal function of neurons, leading to Alzheimer's pathology, neurodegeneration, and neurofilamation. Neuroinflammation. There you go. Neuroinflammation. The underlying science for Simufilam is published in peer-reviewed journals, so it's all there. And we talk about the SavaDX. Now, guys, it's up to you. Are you willing to invest to a to a science that is very futuristic, to a medication that is very effective for Alzheimer's disease and dementia patient. This is the only medication I think right now that is really promising. The other medication right now that they are using right now, they are not effective. They're not helping at all. This is just my opinion. My name is Rara Coco. Please subscribe to my YouTube channel. And thank you very much for watching.